Good evening. I'm Michele, host of Ready or Not Prepares, the Disaster Preparedness Podcast. And I'm coming to you this evening to pretty much just alert you of some of the communications that I've received throughout the day today. And that communication was that on Monday, March 16th, the Trump administration plans to have a press conference in the morning to talk about bringing about more restrictions to the quarantines that we are now going through. I think Vice President Pence has said there will be broad based recommendations for more restrictions as it relates to the quarantine. Now, here's the thing in Europe, Europe is now the new China, and the coronavirus is just rapidly spreading in Europe. One of the hot spots is Italy, and following behind Italy is Spain. So they have lockdowns, especially in Italy, wherein everything is pretty much closed. Only essential places are open or available for the public. So that seems to be the way that America is going, but loosely. So they're not really calling it a lockdown per se. They're actually just calling it, as I said, Pence is saying it's broad based recommendations for restrictions. Because there's a doctor I watched last week who was on the Hill. Health officials had hearings on the Hill last week. And there's a Dr. Fauci, or Fauci, Faudi, and Dr. Fauci is the director of the National Allergy and Infectious Disease Institute, I think it's called. And he is calling for, like, his desire is for us to have a lockdown. Now, a lockdown is just everything is closed. And in some cases, even the military or the National Guard is in place for a lockdown just to make sure, everybody is inside and not spreading the virus. Because I'm told, like, right now, a lot of the health officials and the government agencies and administration, etc., are looking at this coronavirus as if Americans, or they're saying Americans are not taking it seriously. In many segments of the community, people are just not taking it seriously. I was told in Illinois, like, people were out for this weekend for St. Patrick Day events, like in the bars, and people are still going to restaurants, etc. So, again, Dr. Fauci feels like, America is really coming short on the responsibility of not spreading the coronavirus as rapidly as they predict it will be spread here. So we have to do more in America, and that's what Dr. Fauci is saying. So he's calling for a lockdown, and in between that, you have the Trump administration that's actually just loosely calling for a lockdown. So what are the expectations of that? That would probably be restaurants, bars, movie theaters, etc., are curtailed. So they will no longer be servicing the public. You probably will still have, like, your metros and your bus lines, etc., running possibly, but on, like, restricted schedules. And essential businesses or companies like the grocery store, pharmacies, doctors' offices will probably be in operation, but on limited time frames. Especially the grocery stores. I keep hearing that the grocery stores will change their hours and not be open as long as they usually are. So that being the case, I've kind of gone around at this point to research what's going on in the grocery stores, and many things are being bought up. I just hope that we're getting the essentials. Get things that will last you anywhere between 14 and 30 days. I think right now the government is pretty much doing the quarantine, moving it kind of fluid. It's kind of fluid in the sense that they're maybe taking it a week at a time. I know at my firm, we're working remotely this week, and then they'll make a decision about what happens next week. So I think people on the ground are just kind of just trying to see how things are moving. The CDC is saying they are canceling large gatherings and big events for 8 weeks. So that takes us into May. So that's a high. We know that there is an agency that's predicting up to 8 weeks. And then there are some people that are looking at about 14. So that's pretty much the margin. Anyway, in terms of the things that we are getting from the grocery store, if you do like some meal planning, you can kind of plan out what you will eat for the week. Again, I think the grocers will be open to some extent, from my understanding, but it will be limited. I'm told that President Trump has said that he's spoken to, grocery store directors or managers or what have you, and he's asked that they be able to supply the demand. And lastly, one other suggestion that I do have, I've gone, as I stated, in the toilet tissue, we all know is gone, water is gone, those are the staples, milk is gone. I've seen, I was going to make pies, and I happened to go down the aisle for the pies, looking for the pie shells, and looking for some kosher pie shells, and I looked, and there were no pies. I said, well, are we all baking for quarantine? But yeah, the pie shells are even gone, and a lot of canned foods are gone. I'm not a canned food eater. I pretty much eat fresh produce, but I would suggest at this point that you have like your soups, things that are, that you can put on that are canned, things that will get you, again, through the time frame that's predicted. Lastly, if you're able still, I would suggest going out to get medication that will help you should you get any type of virus, or because the virus is coming in different forms in different people, from my judgment. I know people who've had bronchitis infections now. They are having sinus infections. They are having flu-like symptoms. So something is definitely in the atmosphere. And at the worst of it would be the coronavirus. Now, as far as the first responders, as we see with the government and some of these agencies, they're not getting to you right away. So one of the rules of disaster preparedness, and what I've said on our podcast, is we need to practice self-resilience. And through self-resilience and reliance, you're able to kind of put some things in place for yourself. So my recommendation is, as you do go out to the stores or the pharmacies, kind of make sure you have the things that boost your immunity, get your vitamin C, get your prescriptions in place if you have prescriptions in case we do have a lockdown. Get your teas, get your pain relievers, things that would help you should you happen to get the virus and you can't get to a hospital. So you want to get like Gatorade or Pedialyte, something that will help you with your electrolytes in your body. I know many of the patients that did get the disease, many of them said when they were in the hospital, they were given Gatorade and they were hydrated extensively to help get rid of the virus. I'm also told they were given magnesium or potassium drips. So if you could get kind of some of those things, because the worst case scenario is that you get the virus and then you'll have to kind of put some things in place for yourself to kind of treat yourself until you're able to get to a hospital. My last recommendation also is to make sure you speak with your doctor, or find out right now what hospital is closest to you and what are their policies as it relates to the coronavirus. You don't want to get it and not know where to go, or not know what the process is for the hospital. That's all for now. I just wanted to kind of touch bases with you, make sure we're all in preparedness. I'm wishing us all health through this virus and through this pandemic. And I will be airing a podcast today. Make sure you take a listen. Ready or Not Prepares, the Disaster Preparedness Podcast on all major platforms. Wishing good health to you. Peace.